The harvest is plentiful, but the workers are few. Ask the Lord of the harvest, therefore, to send the workers into his harvest. Following the command of Lord Jesus, the pioneers of CMI St. Paul Province, Bhopal, ventured into the mission territory of Madhya Pradesh in 1968. Since then, the members of our province shed their sweat and blood to nurture the mission after the model of our founder, Saint Chavra, the champion of the poor. On a priority basis, our pioneer barefoot missionaries walked into the remote villages and addressed the issues related to the basic needs of man: food, shelter, clothing, health, education and livelihood. Rural Development Service Society RDSS Silvani has been one of our prestigious projects since the inception of our province. It became a platform to launch major projects in the mission for the welfare of the people, and they are reaping the fruits of the hard work of our pioneer missionaries. When the mission was expanded to the whole of Madhya Pradesh, our province registered Sanjeevani Service Society in 2003 as the official organ to coordinate all the social work activities of St. Paul Province, Bhopal. Sanjeevani is focusing on a large group of people who are marginalized and are voiceless by initiating programs and establishing institutions for street children and people with disability. It improves the livelihood of the rural farmers through agro and environment-based support systems. Good number of activities of the province are coordinated under the Sanjeevani Service Society. To begin with, Aanchal Bhopal is a rehabilitation program for street children, initiated in 2010 for rehabilitating runaway children found on streets, railway platforms and slums. It addresses various issues related to street children by reinstating their lost childhood and providing wings to their dreams. Aanchal has a children's home for girls in Bhopal. Aanchal runs 2 childline projects, Railway Childline Bhopal and District Childline Narsinghpur. Aanchal Childline has rescued and rehabilitated 1,800 children and newborn infants from difficult circumstances. Rescue and rehabilitation of abandoned people, outreach programs in slums, juvenile homes, children homes makes this mission unique. Udaan is a community-based rehabilitation program for people with disability. This project, basically supported by Manos Unidas, covers 150 remote villages of Chhindwara district of Madhya Pradesh. The center focuses on the treatment and rehabilitation of people with disability and cancer. The major activities are certification of people with disability to avail government schemes, corrective surgery, plastic surgery, referral treatment at multi-speciality hospitals, regular checkup, physiotherapy, income generation program, training and awareness generation. Asha Kiran Bamhori is institutionalized rehabilitation for children with disability. Asha Kiran is a venture to create role models from children with disability, especially from remote villages who have no hope of future rather than accept disability as fate. We have 35 children with physical disabilities who are regular students of our Saint Chavra English Medium School, Parasia. These vulnerable children are now gems of this institution who outshine the normal children. Our experiences prove that disability is not a curse but ability with a difference. Asha Kiran Special School also takes care of 25 children with multiple disabilities. An empowered inclusive society was the vision of Saint Chavra. He believed that education alone can transform and empower the society and will bring about social equality and progress. Sanjeevani Vidyapeeth, Usri, an English medium school, established to nurture excellence in terms of character and competence through child-centered and eco-friendly education in the rural tribal area, is instrumental in creating enlightened leaders sensitive to the fellow being and nature and rooted in the cultural ethos of their own communities for building a just and harmonious society. The excellent academic performance proves the success of this institution. Chavra Spandan is an initiative of CMI St. Paul Province to coordinate, document and monitor all the social work activities of our English medium schools. It proposes an integrated vision of social work amongst the youngsters, which includes helping the poor, sharing resources with the needy, supplementing the mainstream education, promoting the education of girl children, fighting against exploitation of children, protecting nature and natural resources. All our schools are conducting one major social action program every month, and it has become the part of the annual plan and syllabus. Sanjeevani Multi-Skill Training is a residential and day scholar training program meant for dropout children. Skill training for income generation and better lifestyle courses are also conducted for them. Hundreds of dropout girls have completed their 10th and 12th grade examinations through this project and have proceeded to do their higher studies. Chavra Bhandara is a feeding program conducted in 2 district hospitals for the patients and poor people. Christ Home takes care of the district hospital at Guna, and Chavra Vidyapeeth takes care of the district hospital at Narsinghpur. Sanjeevani Medical Help Desk is an initiative to facilitate patients from remote villages and slums for advanced treatment in medical colleges and multi-speciality hospitals. We could help hundreds of patients from remote villages and slums under this program. We admire the simplicity, generosity, and timely help of great doctors towards this life-given mission. Sanjeevani extends its helping to all possible disastrous situations. The flood victims of Kerala were supported with the help of our members, institutions, and stakeholders to restore a normal life. Let us be proud of our fathers and brothers for their strenuous efforts in serving the distressed people at the time of Corona pandemic. Most of our institutions were actively involved in distributing provision kits for the needy people, feeding the hungry, availing our institutions as quarantine centers, joining government officials to conduct survey and distribute masks and sanitizers to prevent the spread of coronavirus. Besides this, our province provides monetary help to the poor for advanced treatment, marriage, higher education and construction of houses for homeless people. It is a wonderful experience to have the unconditional support and cordiality of the members of our province and associated CMIs who are really sensitive to the cause of the poor. We experience the compassionate love of Jesus being radiated through our life and the pulse of Saint Chavra in our mission. May the legacy of our founder continue to inspire us, and we may experience the providence of God in all our mission for the poor and the marginalized. Let there be no day in your life in which you did no good to others, says Saint Chavra.